A strong, robust, and trusted public health system is one that has the resources, the tools, and the authorities to be able to promote and protect the public's health. It's a public health system that you then see able to reduce rates of chronic disease, to be able to address infectious disease outbreaks rapidly and effectively. It's one that's able to detect threats such as environmental risks, helps to promote maternal and child and family health, and it's one that is trusted to be able to provide effective communications to communities to know how to promote and protect their health. Since 2008, Trust for America's Health has been issuing a blueprint report every 4 years to inform the incoming administration and Congress about key national public health priorities to be able to promote and protect the nation's health. So it's vitally important that we provide this blueprint for the incoming administration and Congress, because regardless of the outcomes of the election, public health will be key.
Public health has been systematically underfunded for decades.
When we are speaking with members of Congress about what's important to local governmental public health, we often talk about the need for investment in infrastructure and in workforce. Infrastructure means the things that allow our local health departments to get work done every day. The buildings that they use, the equipment that they use, the data that they exchange and use to help inform their decisions. Everything that helps them to operate on a day-to-day basis.
One of the challenges that local and state health departments have is that their funding is in small, discrete cycles that doesn't allow long-term planning and it doesn't allow strategic investments. I want health departments to be able to look at the horizon and say, this is a threat that's coming. I need to invest resources now to do that. In order to make that possible, the funding has to be predictable and sustainable.
There is nothing partisan about protecting the public's health. Health emergencies happen in every community, in every state, whether it's a red state or a blue state. And it's important that we have the systems in place to be able to protect and promote health, especially in times of crisis.
A lot of departments, unfortunately, have antiquated systems that need investment. There's no reason why we should be faxing. I think the biggest opportunity we have is in modernizing our data systems to be brought up to the times, to be integrated both within their department, with exterior partners like hospital and healthcare systems, and with the CDC and other agencies.
Federal investments in our local public health departments, in our public health system in general, are critical to allowing us to be able to do the work on the ground to prevent illness in communities, to keep them safe, to address outbreaks, and also to address the continuing threats that our communities face every day. Local health departments are on the front lines of public health in their community. They are working day in and day out to ensure that community safety and wellness. They are the community health strategists for their jurisdictions across the country.
The thing that's unique about public health is that the return on that investment is enormous. And healthy communities are economically viable communities.
The next administration has a unique opportunity to strengthen our public health system by investing in prevention in our country, by really focusing on what it takes to keep people healthy and well.